Right. Greetings, comrades of the APC. This na the APC Diaspora Online TV platform, and me na comrade OrWanKasu. This na the one-to-one exclusive interviews that we dey do na this platform for bring can comrades them who can talk to we about them stewardship within the APC or within the community and the country at large. Today we get a very interesting and very important topic for can discuss. A topic we very I would say very personal, very touching, very important for we as Sierra Leoneans, as a people, and one way a topic way not to everybody can lack for discourse. And today we get a comrade, a professional in that particular field, where they can talk to me today about this very important topic. The topic, as we all can call them, now FGM, in a female genital mutilation. And of course, Sierra Leone, now one of the country them when I signatory to the international treaties signed for ban FGM. Of course, Sierra Leone, a country where culturally we don't practice this for centuries before this ban came. And we country, we governments, we don't sign up to this international treaty for ban FGM. Recently in Sierra Leone, precisely Kenema district, the women them take up on themselves or come out on a particular day, on a Sunday, for practice this cultural thing we all they call FGM, and advocates them around the world against FGM. We are taken by surprise that with governments we don't sign up to this, and we get the first lady and all the other women them then stop all the men them from coming out on that particular day. Then come out and celebrate this particular FGM. So today we want for use this program for educate listeners and viewers the clinical complications of FGM, and we get a professional we did answer with we today, where they can talk to we. Now, post we know sabi, post we don't kind of this platform before we don't can talk to we now. Now, post we within the Sierra Leone community, now post we within the APC, and he hold a very, very prominent position within the APC. But today, it is not about APC, it's a national issue and a clinical issue where India at the center of them, and they within in academic qualifications for speak with authority on this particular topic. Comrades and compatriots, this person is no other person but Mrs. Jammie Koroma. We live in the UK and Ireland, and of course, the wife of the chairman of the Reading and Oxford constituency, and she's also the Secretary General of the Diaspora Women's Congress at the APC. And a person with a professional, so Ingo can talk to me about this particular issue. So, Jammie, welcome to the APC Diaspora Online TV platform.
Thank you.
Right.
Thank you.
Tell we, Jammie, you now a professional on this particular side. Give us a little bit of your background in this medical or FGM side. Make we get an understanding. Don't know the authority where they speak from.
Okay. Thank you very much. Greetings to all viewers and listeners to this program. Thank you so much, OrWanKasu, for giving me this platform for use the APC Diaspora TV platform for have a chat about this very important topic where for some of us, it's a very niche area, and we've taken particular interest into this area because of reasons which I will dive into later. For me, I start my FGM professional or specialist interest in this area since doing my midwifery degree. And as I was looking around for see what I really want for study into, I want to do something where go be of special interest to me, where I go able to dive right deep into it and understand something and enjoy for Dwam. Because when you do your dissertation and you draw on a topic where you know really they enjoy, it makes it harder for you to do. So then FGM came up into my head thinking, oh, this will be something that I really want to learn more about. And therefore, where I do my degree, my first degree, it was obviously on my, I use FGM for write me dissertation. And not stop there, I continue for work, even within the hospital, became the specialist midwife within the hospital that I worked, which was Royal Berkshire Hospital. Worked there, did a lot of teaching for not just midwives, but also students, but also the medical team, and also even going as far as teaching the medical students in Liverpool tropical disease to teach them about understanding what FGM is all about and why we are really diving into it and what are the complications and how to tackle dealing with it and dealing with patients who you would encounter or we will make themselves known to you, say they are survivors and how we can support them. And also supporting to reduce the chances of children being exposed to being a victim or being exposed to the risks of actually being mutilated. So and not just stop there, so I became even more interested. And when I do my master's in public health, I then went even deeper for focus on a specific area of FGM, the complications of FGM itself. which was the urinary tract complications with women in the pickup during their life journey, when they even realize, say, na as a result of FGM, na make certain complications or certain challenges that when they undergo in life. So I've been therefore decided to make her do something on them. So I went into it and dive into it more and do my thesis in it to achieve my my master's degree. So
Okay,
hence the reason why I'm so passionate and I'm so into it quite a lot
fantastic.
on that basis.
Thank you so much for the background there. Now, it set you at the platform for speak with authority on this very topic, and we know say you don't do a lot of research in them, and you're very connected to that. And of course, this program today therefore be one of education. Like I've been saying earlier, we educate the viewers and listeners of this program today, and we go get for confront this particular program, going into the nitty gritty of them. Okay, we get for confront them head on, because people can tend for balance the words them. We get for be explicit. We get for go like into the in total of this whole thing, so people go understand exactly, the complications and within some of we sister, mama, the auntie them don't go through, inside this FGM. As a professional, um, this platform, you dey at liberty for explain to we, for tell we, not hide anything, not to what is said, because we been get the impression, we've been led to believe, say, this FGM na some kind secret society where man not forget anything for do with am. If man comot na door, like way it happened recently in a salon, something they happen to that man dey. So this myth, whether it is a myth or na reality, we don't know. But I'm gonna be asking critical questions, and let we self understand. And I'm gonna be asking the layman's questions for let the viewers themselves understand who side this particular campaign they go. Because as far as we concern, we have a culture, the Bondo society, like culture we Sierra Leoneans them, we all experience, we they see them Bondo people they dance, then picking them, the shema, then they put them in white, cover in white kind of thing, give them beads, then they dance, then they clap, the narrative day behind that, we will get to go into later on. But now that will be no. Until recently, there's an international treaty we say for Banam. Why make them for Banam? A lot of we question that. Why make the people learn at the West for tell we for ban we own culture? Very what is it? So now they we come for can discuss this particular topic here. So then call an FGM, female genital mutilation. People they question why make them for call them mutilation. Why they for call them mutilation? Because as far as we concern as Sierra Leone, so we know na the tip of the cleats and the cuts, and that's it. Why them for saying and mutilate, then they mutilate? So these are some of the questions we some of the layman they ask. So Mr. Jammie, explain to me a bit about this definition. Why do not say female genital circumcision? Why mutilation?
Okay. Why we the WHO actually changed the definition from circumcision or cutting, it's because of the generic, because you get different types of FGM. So the WHO in 2010, actually the definition was of female genital mutilation is part or complete removal of the external female genitalia. So basically the removal of that external genitalia, part or complete. Okay, so it varies from where it's coming from in terms of whose area we located. Okay, And the injury itself of this female genitalia can vary from person to person, also from country to country in terms of what they are doing. And mostly the reason being is it's been done for a non-medical reason. Non-medical reason. So because of that, of the different types that will, when they do the female genital mutilation, it varies. So the cutting varies from different places. So as a result of that, that's the reason why we had to use a generic terminology. With that terminology, some terminology they go cover every type of female genital mutilation that is being done. So that's
Okay.
the reason why they actually changed the name, because it's
Well,
not just cutting.
for we wey comot Sierra Leone, we know we don't get an idea. We don't meet women then they don't go through this female genital mutilation way they describe na the WTO. We they feel like for say the word mutilation, when you say mutilate, like when you butcher, a raw meat.
Mhm.
And for somebody who not ever come across a woman we don't go through that process there, it go think in a mind for say, oh, they don't butcher that person, they are not even want to forget anything to do with her. You understand?
Yeah.
So it kind of like a bit too extreme a word for describe that particular thing there. As women, even though waiting they do to una, it's not waiting una been want, and una don't stand against that now. But the word itself is very derogatory to una self, una own dignity as women. So this is not the thing where some of the laymen them they talk about now. So why not use the word simply as circumcision, and then you can go into the details in explaining it, but the word itself don't create some kind image of brutality on a woman. And a Western man will not ever come across a woman we don't go through that process. If you then ask the woman, you don't go through that process. So the Western man go say, no, I don't want anything for the woman. She's been brutal, she's been butchered, or she's been mutilated. You not think say that makes sense?
Well, for somebody who come on salon, I can understand where side you come off from. But when you look at the different types of FGM, female genital mutilation,
That's a bit of a teasing problem.
is
Hmm.
so when you think of type 1, where not just cutting off the tip of the clitoris, or even taking the totally the clitoris off, that is, in as much as yes, it's still bad, it's not as worse as when you're talking of a type 3 FGM. And type 3 FGM, OrWanKasu, is really that if I start for breakdown, first of all, within type 1 is basically removing the tip of it or part of the clitoris or all of the clitoris. Type 2 is removing the clitoris and also the labia minora. Minora is
Hmm.
basically the inner lips to the clitoris or to the vagina
Okay,
or
the
to
lips, the lips. Okay, yeah, yeah, yeah.
then when you go into type 3 is removal of the clitoris, the labia minora, and the labia majora. So the labia majora are the outer lip where they see in any female organ. When you look at the woman standing up, that's the outer lip where they see out. They remove the inner lip. Then they remove the clitoris. Then on top of that, then they stitch that area there and left just a small pinhole for the woman for
Mhm.
pass urine. Tell me the degree of that day. You not feel say that area has been mutilated?
Well, yeah.
So that's the reason, because then they mutilate the area, and that is not just type 1, type 2, type 3. But also when you go into type 4, even though they're not the cut, but then they mutilate the area and then they do cauterization. Then they prick that area. You know, like where back home we can get some of we man they can cut
Hmm.
them back them. Then they do the
Okay.
same thing down yonder. wherein they mutilate that area, they cut on all them. It depends on whose part of the country where you come on. When at that, then they do. Some of them are long, then they pull the labia for let the lips them of the outer lip, they may become very long, elongated. You understand? Some areas then in the tattoo, some then they put piercing. So there is all sorts of ways that when we set up as women and they abuse we own body. So when you go from one extreme to the other, for put everything under the one blanket or one umbrella of how for
Okay.
describe it. It is
Okay. We don't understand that the position where they come up from in terms of explaining why you go agree say na mutilation. Now we want to talk about the environment where this mutilation they take place, and we want to talk about the people them where they conduct this so-called mutilation. How professional are they for do this particular thing? Which kind of medical tools do they use for do and how they can do are they trained? Is the environment where they do a very clean, proper setting? We then go for do for save the lives of the people them because there's going to be bleeding and stuff like that. Because as far as we're concerned, culturally, the bush they can go. We lights no did no kind of electricity no did not just bush. So we can wonder what they play inside that particular bush day. So explain to me how the setting look like.
So the setting itself is one of the biggest factor where they expose the women them or girls them to so many complications. Environment one, na grown most of the time in the drum. If you lucky, sometimes they go put leaf then na grown, then lay the pikin or the adults na that grown day for cotton. The instrument when they use for do the cutting itself. Now old rusty knife then they use. Traditionally, in their secret society, they are a ritual saying I then left the name for you. So then I don't use them for you. You as ancestors them until at the same name they use pan them because that's what they believe in for use for everybody when they mutilate or when they put society in that particular bush day or environment day. So one, we all know say medically for some of we get the opportunity for being medically trained. Some people then they will get complications of blood clots in of their blood to clot, where they can call factor 5 Leiden. If you get that condition, it basically they expose you to when you cut self your finger, something and they stop for bleed because you not get that factor on your body where your body straight away they kick in for let it allow your body blood for let it clot. So just imagine if picking day with another screen for let them find out whether it get them or not, then go expose them to such degree of cutting. One, the environment, no tetanus injection is being given. The environment is dirty. The people that way they do the cutting safe, majority of the time, they are under the influence of alcohol. Most of the time, they don't drink before they do that. Because just imagine, as a normal human being, they're normal for they just go sit down until somebody in chest and happily just sit down the normal for they go and cut. And sometimes, depending on how many picking and input, then can input from as little as 2 to talking of 30, 40, 50 picking them. So you get for be under some sort of influence for let they in your normal state for let you actually do such things and carry on as normal. You understand? And then because obviously of the influence, that also has an effect on the type, the kind way they can cut you. If you the picky when they go cut or you the adult when they go cut get so much strength in you, now battle for let them cut you. So just imagine you don't go under the influence of alcohol. Your focus is being affected to some degree. Then you get this person where ledom, where they try for court, where it be for say, all ledom still, it affects, obviously, you get for fats. because then they go do something to your body. So that's two things they in self, they compromise how well you're thinking, oh, I just they go for go pull the tip of it. So that tip they can end up being the total being removed. That total where you have for pull the total, just the clitoris for like you pull just the clitoris can end up you taking part of the labia minora because your mental brain, how you work, is being affected or influenced by your mental state at the time of you actually wanting to perform that particular surgery, because I would call it a surgery of you cutting, removing something way before say you don't know waiting at the state of that individual. No tetanus is being given, no cleanliness of the environment or cleaning the environment before it gets done. So all that is affected in how they do the thing, and also how the whole thing they carry on. So because of that, we women them or the girls them have been exposed to extreme situation of infection building up,
Right.
and also tetanus, and also bleeding complications, and also the degree of which you're being caught. So all that they get a huge effect on the environmental
Okay.
factors.
So, parents, them, we don't go through this process. They're quite happy for going through that process. And then they encourage them, picking them also for go through the same process. And there's this taboo na Sierra Leone that you will not go through that process day na Sierra Leone, then get a taboo name where they go call you, where they call that person the burka, pantimni. Person we not circumcise, we not go through that bond of society, to woman, to that kind of, go through what me don't go through. So you're not a woman enough. You are some kind of a burka. When a taboo word for Sierra Leone. So how then people that will not go through and can feel back in the days when they cost them. Because we don't see somebody when an adult. Because in party they all don't go through that thing. They cost some that the street to Saudi. So then we get bondo around the area. That girl they come out, it go inside the place. He say himself let them go circumcise them. Because in party then they cost am say in a burka. So that taboo, that stigmatization, mean day Panam to an extent, it go risk in your life into that particular thing there. So these are the things where I feel say they in the country where some women them feel say they have to go through them because you mama, you granny, you auntie them, you cousin them, all the other people that don't go through them. So it's like it's just the same path we are all supposed to go. Otherwise, you are not the woman who you're supposed to be. Is that a myth? Is that a reality? What do you think?
Culture and traditions play a huge role in our lives, coming from environments and countries like that, because that's what we believe in. They are our cultures, they are our values that we are born into, and we don't know any better. And I can give you a typical example of myself sitting here. Okay. Me, I go Bundu when I was 8 years old. Okay. And where I go Bundu, now me put pressure on me own family, me granny, because I try for go through me mama find ways for go around it. Because say traditionally as well, it's not something you talk about. It's a taboo to talk about it. So in as much as I not be no waiting and they do behind that shrine or in that Bondo bush as such, but I've been still one for go, because anytime I go holiday to me granny, I can feel like left out. When I can sound the drums, then everybody, even then small picking and some of them are big pass, they all go na Bondo bush. I mean, when I'm going to left, in the middle of playing, children, when I dip and play, then all of a sudden as they hear the Bondo drum, so all man don't left, don't go, all the women and they go inside Bondo bush. As some of you now we can left. I begin feel different thinking, What is different about me? Why can't I go? Everybody says, no go there, no go there. You know, they put that fright in you. And yes, I didn't go, but at the same time, that had a negative effect on me in the sense that I was very curious as a child. And I wanted to know what goes on behind that bafadi, BND. Wetin dey happen? Wetin make people then they go, and me know the goodie. Why make I not for go? Wetin I need for do for let me serve go goodie. So curiosity took the better of me, and I started putting pressure on me own family. I tried my mama, it no work. I remember probably about the age of 7, my mama take me go na Bonobushi pay them, so with them just lie to the normal say, do you have for sort this bikini mouth because this was you know they give in. Do you have a just take and go inside the normal go knock drum, we go cook, we eat, we dance, we pull and back na do and do all of that. I come back na do now, sit down now, they play with me, baby. Now they talk to me, baby. Say, they tell them go put me to two bondo. I go gladi. Me and my straight to nice say, this speaker not the ever able for Fulham. So that pass. What I notice say me mama no buy into me. What I do, I go through me granny. I go to me granny and go beg me granny, say, do ya make me granny help me make her go bondo. And all of that is because I felt different. I felt not the same as everybody else. And it be really gets a negative effect on me. And as a result of that, I kept on pushing. I push. So my granny said one tell I go holiday. Now my granny tell me say, he say, I don't ready for you. He say, we go put you bondo. I was so excited about it, but I did not know about the cutting, to be honest with you. I just felt it was somewhere that you have to go and then they will just do dancing, whatever, do some rituals or whatever goes on there, and then they pull you back and I do, and that's it. I was completely blind to it. You know, my family, everybody, it's their tradition. It's what we know. That's all they know about, is that every woman has to go through that process. It's a journey of life. And it is the line where every woman for falla. But that doesn't make it right, in the sense that now we know how this they affect women them, how this they affect we picking them. Why we for continue for practice something? We not get any medical reason for let we do them. Some people then they compare them with man, say, but then they do man circumcision. Man circumcision and woman circumcision or cutting or mutilation. It's not to be compared.
All right.
It's not to be compared.
Now we are talking to Jammie Koroma, of course, a professional in the field of FGM, and of course, this is not the APC Diaspora Online TV platform. Like I've been saying earlier, we go into the nitty-gritty of this particular topic, and we don't get any barriers right now for talk about this, because it don't become so prevalent that the country, we own countries how come out, that people like Jammie get to come out and speak brutally about the brutality of women na the Bondo Bush. So me technical director Denayaso, when Mr. MMBB Mo Bangura from the Reading and Oxford constituency, and the producer of this particular program. That's what today. I get a video where you don't indicate say you want for play, for make we all see that video there shortly, and then we will come back to Tona.
Oh my, come here.
Well, Jammie and viewers, everybody don't see this video, and these are some of the things where we dey see back home in Sierra Leone, our villages, then our communities. We dey see young lady them. We don't just begin to pull breasts. We dey come up and they don't paint them in white, and they can't dance, and they give them money. Say there's new shame at them. They don't become a woman that we really don't ready for be a woman, basically. And now the time you can see money they go hang now, they watch them baby they now would I in Bobby cack past the other one, would I get fine shape past the other one, or make them go able for choose the one then go get now for say this that go be my wife. So these are all exciting moments then for we communities. And but before we go into that one, um, we want to look at the moral side of it. The moral side of it. We Africans, we are very religious, whether we are Christians or we are Muslims. We very religious, and particularly when it comes to we girl picking them, we can very overly protected of we girl picking them for make them all go astray. And one of the purpose of Bondo Bush now for go prepare you girl picking how to become a responsible woman, how to become a good housewife, how for able for born plenty picking and look after you picking them, respect you, which is learn how for cook, learn how for look after your husband, you know, na bed or any kind way. That is some of the things that we can do inside the Bondo Bush, where we stand for understand. And generally, we get the impression, we get the thing say the clit, now a very sensitive part of the vagina. Now they the sweetness day for the woman. At the head that one day where they capture the how you call them the orgasm or something like that. So we believe say when a young pikin they grow up, it don't reach now a certain stage of in life. If they not try for put them down and try for give them something we go make it afraid, it go just go astray. Because once you don't get to that age day, you don't begin to feel that clitoris day, you don't begin to feel that sweetness. The minute the church man want them, now rapid, and it go end up for go astray. And in we own culture, who's how we day now we small village, who's how we day. If we know say this woman so, man don't sabia. That one old community, they nobody don't want them anymore. No man don't want them again because they don't touch her. Man don't touch her. And then go get a cultural thing where they go ask for say, well, call name. Go call name the man will touch you. When you go call name the man will touch you, what you need to do? And they go find a man dey one batter per mine, one bushel rest, goat or sheep, big money where the man not ever gets in life. One day in life, just because you don't go touch that young pikin. So what thing they can tend for do, then can go carry them pikin as soon as Bondo Bush, then go put them through this societal kind of process ceremony, or tell them say we the commoner yeah. If you mistake go judge man, that devil, so thing they come against you, so thing will happen to you. So the pikin that can go stand for Fred for church man until they're married. Because they don't want make the girl picking them they with that normal way with them born there without them come. Then they go do that process to go for scare them, for put some kind fear mongering kind of thing on them, for tell them say if na mistake churchman, who na don't kind of bondo bad thing they happen to now. So then pikin they can tend for remain virgin till the time where they go for go married. So morally, it gets some kind of explanation there. And a lot of we elders them we don't successfully manage for maintain that kind of a value day, that kind of a moral value day, till they meet them husband, marry them, that the husband can deflower them for the first time. And then they make big celebration for that. Because then they go confirm them for see the first blood after the first intercourse. Big celebration, and the woman they get big presents. But on the other hand, a woman we don't go through that process, it can tend to be get the urge for sex for man, and the minute where a mistake fall, now rapid it go. Then it will become somebody who just this no more, no man, no one time at the community. And imagine we own small society will get, we own small community will get. Once they don't know say that man, that woman they not to virgin anymore, not to possibly, you know, they don't deflowered. That's it. Nobody don't want her at the community. So it's like it could just be like an outcast, and everybody could just the follow the one. So that kind of thing they tell me, Jammie, you know, things that moral value they make a lot of sense from we own perspective, we the layman that we understand which and waiting we know say the happen about the bush. That particular area they it not make sense to you?
OrWanKasu, just like what you say, it's the moral values of waiting, but that not mean say it's true. And I can tell you say it not be true. Let me they tell we people and that for prevent young girls, for exactly what you say, for prevent them for being sexually active before they meet their rightful partner, or the partner we will say this na me they can marry this woman. And that family honor for say you married, you begin to a man where the begin have been virgin, it gives that family, you know, that's honor. And when people them believe in their honor, and they then pride them within their community, and that was value to them. And therefore, then they expect you as the picking them where they don't born for don't carry that same value. You know, where they don't a particular pedestal, they don't want for can down that pedestal, because if they go here, you say you begin that don't become sexually active before they marry them, and you value na the village, na the community, they drop. So therefore, a lot of pressure they put on, we put them on that basis. But there are so many other connotations them were attached to this same practice. You know, these narratives, you know, of sexual desire, say when woman don't go bondo, a more controlled than woman will not go. It all depends on the individual. The more way some of we don't research into it, we don't know say that top layer is not where you probably sexual urge day for every woman. Some women then are inside a day, as in you pinpoint.
Yeah,
you understand. While some women
what
are
they call the
outside
G-spots.
the G-spot, exactly. So it all varies on the individual, because you'll get some woman there we don't go bundu, but because then G-spots sometimes at the top of day, that takes away that G-spots day. So therefore, it lets up how much they sexually aroused or the man try for make love to them, or they ever reach to the climax. And I can tell you, say 99% of women there we don't go bundu. They know they just reach the climax as easily compared to woman will not go bundu it. I can tell you that for free, because it all depends one usa you G spots there, and it also depends on how the effort with the man they make sure say, oh, this me uma so now uma don't go be bundu, and therefore I go for make the extra effort for like get me woman to that point, so that we'll also enjoy the pleasure of actually making love. Whilst some woman them will no go at the same time, you touch them so much and they come, but they're not satisfied. They just want more and more and more. So it's how you draw the line where And therefore, now for that make you take everybody as an individual. We are all different. The finger, they all not be the same. And therefore, you know, go say, because this work for this person, it will work for that other person. No, we are all individuals, and we all depends on how God make we and how waiting they get we to that point. So that control, or that idea of saying, would they cut the woman because we want forget for let the woman get control and all that thing, and it's just a myth, to be honest with you. It's not really the reason why we for continue, because you not get any medical reason why we for continue for dwell, because there are so many things. You're talking of customs, traditions, you talk of religion, because you get the religious side of things as well, wherein even though the Christians them the religion not dependent, but the Muslims, most Muslims them is what they call the sunnah, and that sunnah they then believe say every woman should be cut. It makes you clean. If you get clitoris, you're not clean. Some other cultures then see the clitoris, because some woman and a clitoris long. It can seem up like small picking penis. And therefore they sit down there as well say, do you know to woman, you're not man. Because it's like you challenge the man in penis, and you self get something like a penis. So man and don't like that idea, you know. Also the fact of virginity. Say if you no go bondo, the chances of you not being a virgin before you married is very high. You've got other places like just for pleasure. Most of them thing also what they do, believe it or not, it's all surrounding men, for please men, for the pleasure of men. People then they draw elongate their labia, just because they believe say the longer the labia, when you and man they meet, the labia they actually hold the man in penis during intercourse, and therefore the man enjoys the pleasure of actually having those lips around the penis during intercourse, and they enjoy it, and therefore they believe. And places like Burundi, Zambia, that's the culture that they practice. Then believe say you get for pull the labia, and you get for belong to a certain level, because now the grandmas them, the older women them, you get the traditionalists them, when then they actually practice this thing, and they begin for duam at a very young age to the girls, so that by the time they reach puberty, when they reach the age of marry, then labia them long enough for please the man, and then they
Mm-hmm.
measure them. So it all depends on where you're coming from, you know, and others is basically coming of age. When you reach the age of 15, you know, for then at our village day of age 50, where you don't pull Bobby, you know, don't go bundu. You understand? And therefore, they put pressure on the woman, them, the man, and they put pressure on the woman and say, if you picking and not marry them, now you fall to, because you're not good for making you picking go bundu.
Okay.
You know, so the pressure they on the family, the picking, the auntie, the grandma, them, then they put all the pressure on the women. And therefore, in as much as some women do not want to do it and they know what they've undergone, waiting the complication or the problems the way that they get, they cannot challenge it, because you get thrown out, you get looked as an outcast. You know, you get driven out of your own village. Would they all not forget connection within family? Nobody. And therefore, if you have to go through something to maintain that, people do it, not because
Mm-hmm.
they are happy. Honestly speaking, the more educated people are now, the more people are understanding. You know, looking at the video itself of the cultural dance and all that, and that is what it is. We don't mind the cultural side of it. Years ago, somebody been come up with an idea wherein it started off really nicely, in the sense of they call it yellow bundu, in the sense that you will go through all the rituals and everything else that happens during the ceremony of putting girls at bundu. The only thing that was absent is the cutting. They started doing that, saying, let's do continue with the culture. This is what people know, this is what people understand, and people in the village, it's like now a job for them. Then so where they are, then people they are so we can't just cut that off completely. How can we, you know, meet somewhere wherein at the same time, then people they ask will not cut them off of them living, because this bondo business now, this some man they get, then the rest with them go feed their family with, you know, small money where they will get per mine and all that thing, and they do in then cutting season, and they you cut Sunday off for them. How are they going to get it? And as a result of that, it's trying to strike a balance
Okay.
somewhere. But then the success not last long, because people just didn't believe in it. Some people did. And to be honest, compared to what the percentage of prevalence was in Sierra Leone, it's come down quite a lot.
Okay.
But yet still, it's one
Mm.
too many. And what you don't want is one child even dying or going through the severe cases of complications.
Yeah,
Enough fear for
that's true.
anybody.
Yeah.
A child to go through it.
For clarity's sake, Islam or Muslims don't believe in cutting the women. They only believe in cutting the men for pull the first layer skin, and biblically and Quranically, it did it that the men
Hmm?
then will circumcise them maybe at little age or maybe at the seventh day when they're born for pull the first layer, because that layer with the cover the penis, it can it can absorb a lot of dirty and it keep dirty. So for cleanliness,
Yeah.
but for the woman inside, not get any which is if they for left like a day, they're not for
No
go into
medical
any
business.
which is so it's more of a cultural thing. The moral part of them now like how they for train the picking for making no
Hmm.
go do any kind of man business at young age because you say the family value, that's the moral side of them. But yeah, but um let me come to this thing. This some of the women that we don't go through this thing, then they experience complications, and they experience a lot of problems, and it's like a personal experience, but not a way they can it's too private to them for explain, for go around explaining to people. They say, oh, I did get this problem, I did get this problem. So it's a battle where they go through right through their life. We're very difficult for them for come for explain whether not satisfaction to their husband, whether not back problems, and whether not some kind of a disease will affect them mentally or otherwise. Now a thing where it's very private to them to an extent, they don't like for talk about them. So that they go through that brutal reality day for years in their lives, where they give them some kind of a mental or emotional kind of torture. What do you think? What do you say about that? Jamie, I don't know if I don't lost you there. I did see you, but I know they hear you.
Absolutely. Absolutely. And that's the reason why medically, the World Health Organization.
Yes, go ahead. Yes,
Oh,
go ahead, Jamie. Yes, I can
can
hear
you
you
hear me
now. Yes,
now?
go ahead. Yes, yes,
Can
yes,
you
I
hear
can hear you.
me? Wonderful. Absolutely. You're absolutely right. And because of them complications they are, and that now one of the reasons then we make, the World Health Organization, um, and we as activists, then professionals, they really talk about it and teaching people about it because then complication they are so can vary. So immediate complications, you're talking of that severe pain of obviously being caught
Mm,
without any pain relief that they can cause even shock, concoction from a child, or even an adult, during then cutting and then processes, then the bleeding, waking lead to hemorrhage, severe bleeding, infection, what we don't already mention about the instrument that is being used, where they then lead to sepsis, where they then lead to severe sepsis can then lead to even concoction to shock as well, as an individual. So the different pain, passing urine as well is another one. That retention, urine retention as a result of pain. When you're in pain, you don't want for go open your bladder because you're afraid, say, if I go open the bladder, that stinginess, that bone, that pain they why they go through. Because of that, some women then go afraid for go, loss of bladder control is another problem, where women and they undergo incontinence. So some women and they don't live for the rest of their life, wherein they're not able to control their bladder. If they cough, then sneeze, wets they come up on them. Then they pee themselves. Some women and they live with pads um, um, panty liner for the rest of their life. And that's because they get for change and for learning how they pass the smell of urine, because of that. Then you've got obviously then things so we can even lead to death, severe cases of death, the long-term complications, them also the severity of the kind way where they actually.
Yeah, Jammie to get some teething problem. Very, very interesting part we talk about now. So, but indeed, it will come back very soon. Um, yes, as we already see, this a very, very interesting discussion with the PAM, and now also a very complicating, very personal, and nothing we so private that people don't want to talk about it. They don't want to discuss it. But this platform is very grateful to Mrs. Jammie Koroma for taking the chance for can to we today, for can talk to we about this very important topic. There's a lot we can talk about. There's a lot we will get for talk about. This discussion not done yet. We go for interview other people in back when activist them into this particular um, FGM, when people we don't stand against FGM right across the international community, and we sister them, Sierra Leoneans them. We don't fight for this, and we got to talk to them. This platform don't begin engage them. So we're happy for get Jammie today. We can talk about this particular issue, and like I say, there's a lot we can talk about. So Jammie, you don't come back, not so we get you
Yes, I don't
clearly.
come back.
Yes,
Yes, thank
fantastic.
you.
Yeah.
So as I mean, they say no more, just they recount some of the long-term complications there. Maybe they talk about the urinary tract infections. So recurrent urinary tract infection where you get UTI regularly. And when you get UTI regularly, you get for they get antibiotics for treat them. But the reasons behind it could be things like because the type of FGM you don't undergo, you don't get overgrown of skin at that area. So even when you're wet, your bladder not they empty completely. So you get a residue of urine where they left, and that urine they with a period of time, it become classified in the sense that they make stone. Like where you get your lime scale inside your kettle. The same thing, that lime scale, the nine they grow, where they develop, it dry, the urine dry, they become classified. It a day in that area, they because they able for pass them. And therefore, every time they pass urine, it become infected. So they get urinary recurrent urinary infection in that area. So when they get too much antibiotics as well, they become antibiotic resistant. So small infection we know for kill you, we know for take a long time for let you treat, go become a problem because they able forget the right antibiotics way for actually deal with that issue. So you get different type of antibiotics, then try different one, and where they prolong the process. Then you get chronic pain. Where menstrual period, where yes, women can get time wherein the period can be painful, but women they will undergo FGM. Then pain is even higher because they get that pelvic inflammatory disease, wherein that recurrence of problems where you get overgrown skin, you get keloid, you get cyst. Sometimes the cyst can be inside, sometimes the cyst can be outside. But all them things they add to the different types of complications the way they get, and therefore women and they undergo so many pains that they undergo on a monthly basis, and sometimes even all the time. Things like sexual problems, where by rights, where they get sexual intercourse, now something you forget pleasure over. So women and they dread for even make love to their man then because of the complications of FGM, because the area never healed. Sometimes the pantap they look like a heal, but the inside is still raw, it's still painful, it's still sore, it's tender. So therefore, they enjoy yam at all. Then they do normal because you feel say I don't married. Now me rights for say I for able for give the pleasure to me man, for they are able for satisfy me man. But not because then they enjoy them, because they get so many other complications then. Difficulty in conceiving is another problem. I can tell you, say right now, in Sierra Leone, one of the biggest problem where young girls and they undergo, where they don't marry, is infertility problem. And I can tell you, say FGM gets a very high contributing factor to infertility problem now with society. especially with women, they would not undergo FGM as a result of this, because you don't get so many other complications then where they not treat. You just they carry on with life. They accept, say this is normal because you don't grow into it. That doesn't mean it's right. Until you know, say, this problem yeah, why they undergo, not so normal thing, you they feel say it normal because you don't grow up. Meter so normal, you don't grow up into it. You they accept, say it's okay. Let me find ways around it and adapt around them. That doesn't mean it's right. So women and they undergo so much, and you've got the psychological side as well, that trauma of when girls and they go through this whole problem. We take it for granted. We feel say, oh, because we don't put on bundo, they carry on within life. That means say, okay, no. Every time where women, the majority of women like Nayawo, they encourage women and for let them undergo smear test. I can undergo FGM. Then they shy away for go take the smear test for prevent them from cervical cancer as a result of FGM. They no one go for go open their legs in front of somebody where they go see one that say, oh my goodness, what make this person your own genitalia look different from the normal, what are they expect and for they look like. Then little things and they and some of them are just the trauma for say anytime when they go for go take the do their smear test, it reflects back to then and they will then undergo FGM. So because of that, it gets recurrent psychological effect on the woman, flashbacks of how badly people then be attack you, sit down at your chest, all you mouth, almost one for die. Just for let them get to that point of actually performing this thing on you where not get no medical reason for let them do them. But because of a cultural thing, then feel say they have to. Then feel say they get right over your body. Then now your private space. Even just taking away that private space there of people that invading your space, that on itself gets so much psychological effect on we women them. And now not take it for granted and feel say for just sweep her under the carpet and feel say because me okay or you okay, the next person we sit on near you okay. No. We
Okay.
are all individuals and it all affects we in different ways.
Fantastic. Fantastic. Comrades, compatriots, fumble them. When I listen to Mrs. Jammie Koroma, the Diaspora Women's Secretary General, and of course, this not free. This lecture way it give so like we Maria de Mare can say to we, it depend pack sense per we for free. We're not going to pay for this. This is fantastic. Um, let we move on. Let we move on because this topic, the call don't begin the face them head on. How they face them so. Now so will they continue for the face them. Till people begin learn, begin understand about this particular thing and then go stop. Because now education, now in the stop this thing, not to a brutal ban. You need to say ban and criminalize people then for let it happen. The mistake with the international community don't make for say complete ban on this particular thing. Don't make a lot of things that happen on the ground, and when death they take place, then they hide them. So there's a way how we can go about this by educating, which you can do so right now. You can pack boku boku sense per week, and we appreciate this one. So I want to ask you, Jammie, what do you go say to women that we don't go through this process? Owner don't go through as brutally as you don't explain that to me so. To we all, the emotional problems, complications, the all the other clinical issues them where people can get when they don't go through this. What you go say to the one we don't go through all this process, but still support this FGM thing with the happen in country, still want for letting picking and go through the FGM. They even risk them picking and come out inside the Western world, kind of go to Africa, goes do female circumcision to them or FGM, they hide them come back inside the country as well. What you go say to them people in there?
It's sad to say what you talk so is a true reality that it still happens. And you get people the ways they do that where they go. I know of a community as well, a family where they're in this country where they hide away from your own family because anytime we meet in family they are being attacked. It's a lot to do with ignorance, it's a lot to do with lack of education, just like what you say, seeking education, listening, and that's why we as advocates, they continue for teach people them about it, they talk about it. Like me, so now Reading, since 2013, I set up a community group now Reading called Women with Vision. Women with Vision is a community group wherein you get women then would already undergo female genital mutilation, women that we feel say then they at risk of dense SF or them picking them undergoing FGM are welcome to this group. This group, we did it for support the women them, for signpost women them. So inside Reading, there's an organization called Reading Voluntary Action, RVA, wherein we are registered and know of us, for say we are a registered group. We work with other community groups that are Reading, where we support women them out in the community. The hospitals them also know about us. So, that education there goes a long way. So we did do events them now Reading, wherein we can raise awareness about FGM, but it's not just FGM, because we all know say FGM on its own are one thing, but also the complications them as a result is another. Just about it's like things like raising awareness for women and for let them go for their smear test. Something as simple as going for smear test, where they shy away from it, you're afraid the psychological effect where they get on you can end up for say you grow abnormal cells them. Now you cervix, they're not able to pick them up at an early stage wherein it could be treated. By the time they realize, they tell you say you get cervical cancer, and the process, the time don't late for let they able to do something about it. So that's education, that's exposure, that's talking about things. The group is like a safe place wherein you they meet with other women that wouldn't undergo FGM. You can talk about it. You can have one-to-one. They even get a gynecologist where link with we. So if we get women away, get problems the way, they need for see a gynecologist where they give them a one-to-one care. And they're able to get that confidential discussion and tell them problem there and get examined. We can do that as well. So all that they help, so women then where no don't go or we don't go, we still they make for let them picking and go because of pressure, not only in Naya, but back home. It's another problem. Even about 2 weeks ago, I get a lady where contact the organization spoke to me for say in a Gambian. In Gambia, they don't ban FGM. If they carry in Pekin and go holiday, now they want lift that ban, and therefore she is scared to take her children back home for going in country because of the fear. For say if in Pekin go with in Pekin them, able for counting gal picking them uncut. So just imagine, the woman was crying on the phone. They explained to me, say, what's the info do? How if I go about this whole thing? And with things like that, when you're faced with situation like that, it's about engaging the woman alone, are able to come together and discuss about it and talk about things and understand the network of people that we around and how best they can able to go around. But for the time being, one of the best advice would be not taking your children there, because if you cannot guarantee you picking say you they carry and go holiday, you bring and come back safe, then it's better not to. Because as a healthcare professional or as a public health, one of the things that what they do is any woman where they at risk for say in Pekin and they at risk of FGM, we get what we call a passport to travel. So that passport to travel is basically we as clinicians, we give you the education, all what you need, and advise you on what you need for do. And also that passport they show unto your family and for tell them say this Pekin, so yes, now na Pekin. But also na England are born this Pekin or na England we day, na government Pekin. This passport nine holes say if una cut me Pekin, we'll go back. Me go jail, me Pekin go jail. Now that's what I want. You get for be honest and open and bring them out to the family and then no for say, may they not touch you Pekin, because then touch you Pekin, you go sue them, you go bring them to the law.
Okay.
You understand? So the best way sometimes, because obviously once they don't cut them, they cannot put it back. So Mickey always say to them, it's better for you to refrain for the time being until you feel say it's safe, or the beginner don't get to a certain age wherein they not go get themselves to a position wherein somebody will go brutally or attack them or forcefully then cry and go
Okay.
for go quarter.
Now,
So that would be the situation
okay.
at this
Now,
point.
Jammie,
Yeah.
Sierra Leone is signatory to the international treaty. We ban FGM.
Yeah.
Currently, as we talk now, so we are in June 2024. 2024 now the so June. FGM has been banned for several years now. Don't remember what when the thing come
Yeah.
to pass when they signed that agreement day. But yet, most recently, Kenema, the first lady Fatima Bio, we don't kind of the Western world like Europe don't talk about answer for our girls and all this FGM thing were part of it about young picking them where they go through rape, sexual abuse from men and stuff like that all over the place. He launched campaign all over the place. It acquire a lot of money. Now in lead, I go say the gang will be the Kenema. They go up and down. They promote this FGM. What you take on this particular thing? Now battle we very, very difficult now for fights because they don't seem for don't politicize them rather than for put them as a societal problem. What do you think?
I absolutely agree. It's a shame, years ago when Fatima, when Madabio take position, and she went on the platform some years back, and actually they promote FGM and Sidom, in an interview they tell them, say yes, Ingo Bundu, get no problem, blah 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 blah. I actually went on to her platform and actually challenged her on that, because one, you cannot sit there and say you are a first lady and that you're advocating for girls and women, and you're saying hands off our girls. You're talking of early forced marriage, but at the same time, you want to promote FGM. How can that work? You're complicating yourself. It doesn't work that way, because we all know, say, FGM, part of the reasons of FGM is to prepare a girl for marriage. So when they promote FGM, which means you're promoting the early forced marriage for women, then for girls to be thrown into marriage at an early age. That is totally wrong. That was very, very disgraceful for a first lady, for actually to promote something where not just locally, but nationally, it's everywhere. And we know, say, nationally, it's been banned.
Mhm.
But that's the sad truth about what
Yeah,
happens in Sierra Leone. On black and white is one thing, but the reality of what happens is another
yeah,
story on its own. And we all know, even when they say they don't ban them, they were still doing it. And what's been happening is that they even go now for younger girls, infancy, picking that we not even begin for crawl it, or we not even waka it or begin talk it. Now they be the target for let them put them bundu before they reach the age where they will challenge them parents and say no. Because now, years ago, when some of we go bundu, then they will not they talk about bundu. So we not even know what in bundu they all about. Now everybody and everywhere, the small pikin says we all 6-year-old knows about what's in bundu involved for saying they go court. So now the pikin and the challenge not for go. And as a result of that, they feel say the best way for go around it now for begin for put the picking them at a very early tender age, which is sad truth of what's happening
okay,
in our country. And until we continue for do it we do so and raise awareness and talk more about it, it's going to be a
yeah.
problem.
So now you know one of the champions of FGM.
Yes.
Yes.
Proud to say
Now
yes.
the community like Reading, like which you don't tell we so we give you accolades for that. And you're the champion also na Sierra Leone, among others them. We have been, you know, happy for where we hosted Ayasu, we Fatia be the host to that. Um Now a fight, now a challenge we very, very difficult for win. But with enough effort, I believe say una go a long way. una go a long way, because the education is one part of them, the law is another part of them, but then the outreach also, it is very, very important for create that regulatory kind of way how people go do them. If they do them at all, let it be safer at least than at the least part of it. But the motive is to make sure say they reduce them drastically. But it's the thing so prevalent in Sierra Leone, it is alarming to the international community. Very, very alarming. If they make una effort, they look like for see all the work on I don't do. Now for nothing that we don't they do. It will not mean anything with the first lady of the country. They go out in the open, they promote, they dance with them people, and they, for promote FGM in the level where they don't do it. So we never see that kind of crowd in the from where born on FGM, on Bondo society. We don't see small group of people in the dance like one village and one community, but a crowd like that in Sierra Leone, it's a shame for we all and for una effort una don't make seem like for say it was just nothing. So I want to give you the opportunity for let you give you final word on this particular thing, and then we'll go call it a night.
Thank you very much. Thank you again, viewers and listeners, for this platform. But the message we're going for get out there is let's not relent. And as this na APC Diaspora TV platform, we get a lot of diasporas then we get for listen to this and watch this video. I dey cry out sooner and ask una kindly, because una family the way they back home, they look up to una. Now, the breadwinners of those family. If it comes from you, if you educate yourself, and it comes from you, and you tell your family, they say, FGM stops at me. Any generation below me now, I not want let them do any cutting. If you they continue for una, I not go continue for do. Honest to God, then go listen to you, because I can tell you, I started. I made sure my family, all the young girls that were there in my family, they are not being caught. I made sure that went across. And I can give you another example. In Kenya, where then they also practice the worst forms of FGM as well. When the Maasai, the Maasai warriors, Maasai cricketers, then actually then come out and actually protest against it and tell them parents and the people then the villagers for say, we not the Maasai them, we not the cricketers them, and we they against FGM. Them they call them vagina warriors. Then say if una caught una picking them, we not they married them. I tell you what, that number went drastically down because of them guys and they we actually stood up as men. So what I try for say Naya is we man them at the diaspora. They have a very strong influence on their wives, their sister, them, their family, them, where they back home as well. So the fight is not just us, the women, fighting against it. We need one to demand them for hold hands with us in collaboration, for Leuna help you for Leu fet this fet here, so for put a stop to it. We cannot do it on our own. We need una for Leuna stand in solidarity with we, for Leuna understand see there is no medical reason for Leu the cut with sister them, we picking them put them through all them form of torture there. So do ya una work with we. Now we're able for put a stop to it. Because together we can all make a difference. Together we can save a child. Together we can save a nation. So do ya, let's work together. Owai Osai.
Thank you very much.
Thank you.
Thank you very much, Mrs. Jammie Koroma, the professional in FGM. You don't pack boku sense power today on this particular topic. And the viewers them will really, really appreciate the input on this particular topic. Now, the discussion we not go end. We will continue this discussion with you and others. And I want to say thank you to the producer of this particular program today, with another person, but Mr. MMBB, the Reading and Oxford PRO, APC UK and Ireland. So I want to say thank you to you. I want to say thank you again, and to all the champions of FGM, Sierra Leone community in the UK. I know we'll call their name right now, but eventually we'll get for bringing them come one by one for do something like this for help una in this fight here. So once again, Mina OrWanKasu. This is not the APC Diaspora Online TV platform, and this is not the One-to-One show. Over to you, sir, Mr. Producer.